to productivity, GDP, contribution, innovation, everything of this country can remain depending upon the future generation of the people. And future generation are entirely dependent on the maternal health. They are the creators. It is necessary that we need to take care of them.
Welcome to this episode of Sustainability Karma. I'm your host Naina Gautam, and today we have with us Dr. K Venkataramana. He's the chairman of Brain Super Speciality Hospital, Bengaluru. Welcome to the show, Dr. Venkataramana.
Thank you, Naina. Thank you very much for having me in this show.
The theme of World Health Day 2025 is Healthy Beginnings, Hopeful Futures, focusing on ending preventable maternal and newborn deaths and prioritizing women's long-term health. What are the challenges that are faced in meeting these goals, particularly in case of India and also specifically in rural areas?
It's very nice that World Health Organization has decided to have this theme for the World Health Day for the 2025 as the maternal health, as the primary and women's health. As you know that woman forms the key role in the society, not only in the maintenance, but also in the health and also for the progress, as well as the creation, what we are having people today. Quality people, if we want to have, we have to have a quality health for the mothers. Having said that, there are the challenges what we are facing today, particularly in India, is tremendous. Primarily, women have a little lesser significance in the society. As a result, it reflects in everything, not only in their social equality, but also in the affecting their health, as well as on all aspects of social and personal and varieties of involvements as far as women are concerned. As a result, majority of the women are uneducated, especially in the rural areas. They are very ignorant, studied with a lot of myths, and the information which is passed down from generations, which are most of them are conventional, and to a great extent they are not aware of the current developments in the world. That's what is happening. Secondly, women are kept ignorant to a certain extent. They are considered as confined to the homes, not in the urban areas, but certainly in the rural areas. This stigma still exists that they should confine in the house, they should remain only for taking care of the family, cooking and nothing else. And as a result, the priority also is less. Women fall sick. The importance is not given so much. Considering the population of India, this problem becomes very significant in magnitude because the only urban population are able to achieve or reach out to the newer developments and newer ambitions that can be equally participated by the women. But whereas rural areas, they are quite backward. So this is the major problem. Having said that, there is a tradition in India. I must say that there is an intelligence tradition which is established over the centuries, and because of that, we are able to sustain even today. Good number of them are very skilled, very talented, very efficient. And knowledge is passed on from generations. And, the people who are not qualified, but they're excellent in delivering babies at villages, the so-called dadis. And, they're much better than some of the professionals by sheer experience and the knowledge they have gained through the years. So these are some of the good points, some of the negative points. His health is taken care of, not only the family health. So what we look at is only the family role, but they have a very big role in the society because they are the people who are contributing to this creation. Now, when a baby has to be born healthy way, the mother has to be healthy, both physically, mentally, as well as emotionally. Now, when a happy mother delivers a happy child, that child's brain is going to be superb and is going to contribute to the nation and to the world. So, if there is a problem, it is going to be totally other way. As a result, today we have, because of sheer lack of knowledge, sheer lack of facilities, and the maternal mortality is pretty high. In addition to that, we have a lot of communicable diseases. Some of these infections can get affected during pregnancy. The so-called safe motherhood is not very much in vogue in India. Now, many mothers, they remain undetected as diabetes, hypertension, and many other associated medical conditions, which complicates their pregnancy, eventually complicating the baby's health as well. As a result, maternal mortality is significantly high. Of course, we have come down from somewhere 128 to 130 to 98, which is a significant growth, but no way acceptable still. We need to put in a very systematic, consistent, long-term effort to make this motherhood program a safe motherhood program, so that the entire society is going to become very safe, healthy, and is going to contribute significantly. Throughout the pregnancy, mothers have to be screened properly, evaluated, treated, and if there are any other associated medical conditions that should be effectively treated. For example, simple diabetes, hypertension, and particularly certain infections can directly affect the brain and cause mental retardation, epilepsy, abnormal brain development, and very many anomalies. So all these are preventable if there is a good screening method and a good maternal care throughout the pregnancy. And during the delivery, we call it as a perinatal period, and that's very, very important time when even a short duration of problems like lack of glucose, lack of oxygen, or any kind of a problem to the mother will directly affect the baby. Our country's pride that we can be the leaders in the world. The productivity, GDP, contribution, innovation, everything of this country can remain depending upon the future generation of the people. And future generation entirely is dependent on the maternal health.
How should women navigate the mental health challenges that come with pregnancy and motherhood?
Throughout the pregnancy, their thought process should be so nice and positive, and they should adapt to good nutrition, good relaxation, good sleep, good music. Even is going to make a big difference as far as the growth of the child and the personality of the child as such. And emotionally, any kind of disturbances that's happening emotionally because of various reasons in this country need to be curbed, and they have to be given a special importance in the family. Mother, not only the mother, the entire family should be supportive.
Postpartum depression is not much talked about. How should women deal with it?
Postpartum depression can be two types. It's a well-known syndrome that can spontaneously occur in many women. So this need to be identified whenever a mother is looking dull, withdrawn, not taking care of herself and not taking care of the baby particularly, which is the earliest sign. If any time anyone in the family notices that she is neglecting that means there is a serious issue. So that's a sign we need to identify quickly and then take them to a psychiatrist and treat them adequately. It's a completely treatable. Earlier we treat, faster the recovery, and they become totally normal. The second depression is the reactive depression. Many times it is induced by the social and other circumstances. Third, very important again, as a neurosurgeon, I would like to reiterate that many times they have a fixed idea that during immediately after the delivery, they should not drink water. There is something like a Jandi dosha, it will affect the mind and things like that, which has come as a tradition from mother-in-law to daughter-in-law. So as a result, they are restricted on fluids. So this sometimes can lead to a condition called CVT, that is cortical venous thrombosis. The blood veins of the brain will get occluded. So this again can cause depression. This can cause bleeding in the brain. This can cause seizures or convulsions, right? So this is a serious condition if it is not treated. So, but this entire thing can be completely avoided by giving adequate fluids to the mother after the delivery. So if we take care of this, and it's a serious condition that will damage the brain, can be avoided. And it's not only the mother's health that gets affected, baby also can get affected directly. A brain not being developed properly, or developing some abnormalities and emotional disturbances. When the mother is in depression and they're not happy, their lactation is going to get affected. So the mother doesn't give lactation and feed the baby at least for the required time. Their overall health immunity, brain development, myelination, everything is going to get affected in the brain. So as a result, their intellectual abilities of the baby can get affected. So this has to be kept in mind all the time. And the other very important thing, which is very recent discovery, is that mother's bacteria, okay, during their normal delivery, they come through the birth canal, those bacteria will be smeared to the baby. And that is very important for the baby to learn sucking process as well as the digestion of the milk. So some of these bacteria come from there to the baby. That apart, what we call as microbiome, okay. So it is very important that parents, particularly the mother, who cuddle the baby, hold the baby to a certain level, at least up to 2 years, till the microbiome of both of them becomes equalized, so that the brain development, myelination, intellectual development, personality, and various other functions of the body is dependent on that. It's a new invention of the microbiome, and this is another message that should be known to all the pregnant mothers.
Thank you, Dr. Venkataramana, for such an insightful conversation and making us go through such newer concepts.
Thank you, Naina. Thank you very much.
This is Naina Gautam signing off for Sustainability Karma.
Hope you like this program. We look forward to your feedback on our WhatsApp number 9818120554. For participation in this program, write to us at sustainability.karma@gmail.com. Looking forward to meet you again at the same time next week with a new episode and a new guest. Till then, goodbye from all of us. Sustainability Karma, a podcast series on sustainable development, sustainability and ESG.